Embryo transfer is the last stage of IVF. We have created the embryos in the laboratory, and then we need to take them and put them back in the endometrium where they get implanted. So how can we do that? We do that by putting a catheter through the opening, the external opening of the cervix, pass it through the canal, the cervical canal, through the internal opening of the cervix, and then move it so that you can leave the embryo at the right place, usually in the middle or higher end of the endometrium, inside the endometrial cavity, which has been prepared before, of course, so that it can have the right thickness, and we can have the right hormones to be inside what we call the implantation window. Embryo transfer can be done with many different catheters. Sometimes it can be very easy and the catheter passes very nicely. Sometimes it can be harder, and especially in women that had previous loop treatments, lead treatments because of HPV, CIN, or past surgery. We have a lot of different catheters that we can use depending on the case. As a general rule, embryo transfer is better to happen with ultrasound guidance, so that we can make sure that we leave the embryo at the right place inside the endometrium. And as a general rule, is mildly uncomfortable but not painful. In rare cases that it is very difficult to pass the catheter, might be needed sedation, so that you can have easier the manipulations that are needed. The easiest the embryo transfer, and the less the manipulation at the time of it, the more chances of have a successful pregnancy.